Instructional practices is the term used by the Division for Early Childhood to designate intentional and systematic strategies that inform intervention activities. These practices may be considered subsets of interventions. They provide guidance, quote, for practitioners, family members, and other caregivers to maximize learning and improve functional outcomes for young children who have or are at risk for developmental delays and disabilities, end of quote. There are 7 core practice guidelines utilized with young children with ASD in early intervention, early childhood special education that are prominent in music therapy practice. 1. Organize the learning environment. 2. Establish structure, predictability, and routines. 3. Use verbal, gestural, model, physical, and visual prompts. 4. Give additional response time and opportunities to repeat. 5. Include active involvement of peers. 6. Plan for transitions. And 7. Apply generalization strategies. An example for planning for transitions in music therapy practice would be using auditory transition supports, such as sound cues or transition songs. If using sound cues, you first have to identify the children's preferred sounds. For transition songs, you can compose simple melodies and lyrics that repeat the central message several times. When implementing the auditory transition support, introduce it to the children and everyone involved for use across environments, situations, and times. Place the sound cue or transition near the location where the transition occurs. Use the sound cue once or sing directly and repeatedly to the children until the transition is completed. Combine the sound cue or transition song with other transition supports if additional support is needed, and make the transition seamless.